After you've had your tests, you'll get your results within about 2 to 6 weeks, and this is posted to your home in a letter. If your test was normal, which means HPV negative, you'll be invited back based on your age, so either in 3 or 5 years. If your test did show HPV, again, it's nothing to worry about. The lab will also check the sample that we've sent them for any cell changes. Okay. If they find that there's no changes to the cells, we'd ask you to come back in 12 months instead of 3 or 5 years. This is just so we can see if there's still a HPV present or not. If it's HPV positive and there are some cell changes, you may be referred on to the colposcopy department at the local hospital, where they might do some more investigations or treatment. Just to give you an idea, if we were to do 100 smear tests, about 87 of those would be HPV negative. You can see that here. And then they would be called back in 3 or 5 years' time. Of the 100, about 13 people only would have HPV. Most of these, so 9, would just need to have another smear in 12 months' time. And about 4 might be referred to colposcopy for some extra tests. So now that we've discussed why we do the cervical smear test, what you could expect at your appointment and what the results mean, we're just going to give you some useful tips. This is especially for people who might not have had their first cervical smear, or they might be feeling a bit worried or anxious. So before you book an appointment, if you do get anxious in waiting rooms, you could ask for the first appointment of the day so that you're not waiting as long and it's not so busy. As we mentioned, most smear tests are undertaken by a female member of staff, but you can also mention that if you're worried when you book your appointment. If you think you'll need more time, so if you have a physical illness which makes it hard to move, or if you have other concerns, you could also ask for a longer appointment for your tests. Obviously, lots of people are busy and lots of people work. If this is the case, we do have early morning, evening, or weekend appointments available, so you could request one of those as well. We suggest that you plan your travel in advance and leave early, just so you're not feeling stressed when you do have your appointment. And if you're someone who wears skirts or dresses, this can be a good idea just to help you feel more covered on the day. And you could also bring something comforting with you, so some earpods to listen to some music. You could even bring a magazine or a book, or if you're a smoker, perhaps nicotine chewing gum. You could also consider taking someone you trust. They can wait with you in the waiting room, or if you're comfortable, they could join you in the room with the nurse for the appointment. If you're someone who experiences vaginal dryness, so this can be quite common, particularly around menopause, you could try using a vaginal moisturizer. That's usually a cream or a gel for two or 3 weeks before your tests. This would ideally make the test a bit more comfortable if you have had dryness. It's important not to put any gel or cream in the vagina 2 days before the appointment because it could affect the sample. If you do have vaginal dryness and you've tried a moisturizer from the chemist and it's still not helped, you could speak to your doctor. So now some tips during your appointment. Obviously, if you're worried or feeling anxious, speak to the nurse or the member of staff about what might make the test easier or what things you're finding difficult. It's important to know that you're in control and you can stop the test at any time. If you're feeling anxious during the test, as Rebecca mentioned, having more relaxed muscles can make you feel more comfortable. So we suggest try counting deep breaths in through the nose and out through the mouth, or any other breathing exercise that you've used before could also be useful. As Rebecca mentioned, you could ask for a smaller speculum if the standard size is too uncomfortable. And if during the test you are finding it uncomfortable for the speculum to be inserted, you could also ask to insert it yourself and the staff member could help you. After your appointment, it could be a good idea to plan something that you enjoy, just if you're feeling a little bit worried. And if you do feel anxious while you're waiting for those test results, try speaking to someone you trust about how you're feeling. And the most important thing to remember is that an abnormal result doesn't mean that you have cancer. It's just a test that we're doing to prevent cancer. So we've just added some symptoms to be aware of. So if you've never been for a smear test, it's particularly important to discuss these symptoms with a doctor. They don't mean that you have cancer, and they can be caused by other things, but it's important to get them checked. So things that aren't considered usual or normal would be bleeding during or after sex, between periods, or after the menopause. If you've noticed changes to your bleeding, particularly if it's heavier than usual, or any changes to vaginal discharge, so that could be the amount, the color, if there's any smell, or the consistency. Pain during sex is also not necessarily normal, so it's worth discussing with the GP or a clinician, as well as if you have any pain in your lower back, around your hip bones or pelvis, and your lower tummy as well. So now we're just going to go through some common questions that we often hear at the practice. As I said, if we don't answer your question, we'll have some time at the end to go over those. So one question is whether or not people need to have a smear test if they've had the HPV vaccine. It's important to know that the HPV vaccine protects against most types of HPV that we know are associated with cancer, but not all of the types. So we do still recommend having a smear test even if you've had the vaccine. Does the test hurt? I think this is possibly the most common concern. As Rebecca said, you can feel the speculum going into the vagina, and some people can feel the brush taking the sample. Most people can't feel it at all, or it feels a little bit uncomfortable. If you do find the test painful, you can ask to stop the test straight away and talk to the nurse. They can find a way to make the test more comfortable for you, but you shouldn't expect to have any significant pain. We also get asked if you should have the smear test if you've never had sex. So it's important to remember HPV can be spread through oral, vaginal, or anal sex with someone of either gender, and it can also be spread through contact with skin. So if you've never had any kind of sexual contact, it probably is unlikely that you have HPV, but a smear test can still be useful to prevent cancer by checking your cervix. Will you still be a virgin after the smear test? So virginity in some cultures refers to sexual activity alone. A smear is a health screen, so you would still be a virgin after the test. If the presence of a hymen is important in your culture, it is worth knowing that inserting the speculum may break the hymen. It's also worth noting this can happen through daily activity such as exercise or inserting a tampon. So having an intact hymen is not always a accurate indicator of virginity. If you can't attend the practice but you would like a smear, unfortunately at the moment we're only offering smears at the GP surgery, but we are looking into how we could offer smears to people who aren't able to leave their homes. There's a lot of testing going on for something called a home test kit or a self-test kit, which means that certain people could take their own sample at home, and it's much simpler. We're hoping that will be available in the future. Can you have a smear if you're pregnant? As I mentioned, you don't need a smear test if you're pregnant. This is because during pregnancy, there are some changes to the cells and they tend to go back to normal. So we don't do the testing during that time, but you should have your regular smear test 12 weeks after birth. And it's important to know that if you do have HPV, it does not affect pregnancy. And can men be tested for HPV? At the moment, no, there's no reliable test for HPV in men or trans women. Cancer is less common in these people caused by HPV, but if they did have any symptoms or concerns, they should speak with their doctor. Is HPV a sexually transmitted illness? Technically, yes, because it's spread through sexual contact. But as we've mentioned a few times, it's also spread through skin-to-skin contact. But it's important to remember, again, HPV for a lot of people is a normal part of life. It doesn't usually need treatment, and most people will have it often without knowing. Do I need a smear test if I'm married or have a long-term partner? Because HPV is so common, we recommend that you still come for a smear, even if you've only ever had one sexual partner. Just to mention that HPV can be dormant or undetectable for a very long time and then become positive. So if you do have a positive HPV test, it doesn't mean that you or your partner has been unfaithful. Should I have a smear test if I've undergone FGM, also known as cutting or female circumcision? You do still need the smear test as with anyone else. If you're worried about coming in for your smear test, or if the nurse is unable to collect the sample, you might be referred to a service which is specifically for people who've undergone FGM. So that's all about commonly asked questions. I've got some useful links on this slide, which Nikita is going to post into the chat. The first four or so are more information about cervical screening and smear tests. Just to point out, the last link on here is for the Female Genital Mutilation Clinic, and they do take self-referrals, so you can contact them directly. The second link from the bottom is a list of clinics that provide smear tests specifically for trans and non-binary people, if you'd prefer to go to a dedicated clinic. And then the third link from the bottom is the My Body Back project. This is a clinic in London which provides smears to people who've experienced sexual violence. All the members of staff there are trained, and you'll be given a 1-hour appointment if you would prefer to go there.